Hi, everyone. Welcome to another episode of Watching Mental Health. And I am so excited because today I think we have a really interesting guest, somebody who is an expert in the field and who is going to come in and provide, I think, a really interesting perspective. And I want to tell you a little bit more about him before we bring it on. So Dr. Eugene Lipov is a leading expert in treating post-traumatic stress. And he's the pioneer of using Stellate Ganglion Block, SGB, to alleviate PTSD and PTSI symptoms. So we'll get a little bit more into that today. But he's been inspired by his own family struggles with trauma and has dedicated his career to restoring hope for those affected. Dr. Lipov has testified before the U.S. House Committee on Veterans Affairs, published extensively in leading medical journals, and has been featured in major outlets including the Wall Street Journal, USA Today, Fox National News, and NBC. And today we're going to be talking trauma, and we're going to be breaking down PTSD, PTSI, why science matters when it comes to treating mental health and these symptoms, and really how advanced brain imaging proves that trauma is a biological injury. So I'm really excited to learn more about that. So with that, welcome to the show, Dr. Lipov.
Thank you for having me on. Really appreciate
Thank you
it.
so much. Yeah, no, I appreciate you being here. You're definitely an expert in the field, and you come, I think, with something that's interesting, and a different approach to treating PTSD and trauma, which is an incredibly common, kind of almost trendy thing that the world is experiencing right now in many ways. And so I think this is a really timely subject. But before we get into that, I always like to start off with asking my guests a little bit more about themselves. So tell me in your own words, who you are and why, why this field, why this matters to you so much.
Fair enough. Well, I'm a medical doctor, so I'm an MD, and I finished medical school in '84. So my father was highly traumatized during World War II. He brought that trauma to our family, so he gave it PTSD to me. It's called secondary PTSD. He gave to my mother, who eventually took her life. So mental health is something that's a very personal condition, and I'm very interested in avoiding those kind of problems for other people, families, or individuals, or whatever. And the way I come at this is physiologic. So I'm not a psychiatrist. I don't want to be a psychiatrist. I don't write medications, psychiatric conditions. So I started as a surgical resident, then I switched to anesthesia after my mother's death. I became a pain physician, and I was doing normal pain stuff. So through an interesting set of circumstance, I was able to figure out that stellate ganglion block, an injection in the neck, it's been around since 1925, works for PTSD. And that's where the interesting story for this podcast began. As you said, I testified in Congress. A lot of military people have followed my work. About 10,000 special forces guys have been treated, and women have been treated this procedure. Their lives have been transformed. The great thing about what we do is what I tell my patients is I come in, they go, it's like, do you want me to tell you what kind of trauma I had? I don't care. Makes no difference.
Sure.
Just the mere fact telling about the trauma is traumatizing. It's unnecessary. It doesn't matter. The needle goes in the same spot. It doesn't matter what kind of trauma you had. I think that makes it very much better for a lot of patients. Also, the response time is very quick. A large number of patients will have a response within 10 minutes. So the compliance is much higher. Because if you think about conventional therapeutic, like medications, takes 6 weeks, if ever, to have an effect. And then psychotherapy, there's all types. And there's certain I really like, and a lot of them are traumatizing as well. Reliving trauma again. Exposure therapy is one of my favorite things to beat up on. So if you look at the therapeutic efficacy of current therapeutics or gold standard therapy, which is defined as pharmaceuticals plus psychiatric or psychological, in the VA, the efficacy of that is about 40%. That's low.
Yeah.
And a lot of it is due to lack of compliance.
Yeah.
And also you have to keep changing medications and all of that.
You find
So
more.
again, yeah. So that's why you alluded to the name change. We can talk about that. I'm trying to change the name PTSD to PTSI, post-traumatic stress injury, meaning trauma causes real biological changes. Like, for example, I was at a major fundraiser for military, and people are still talking about PTSD as an invisible wound or
Mm-hmm.
PTS. The problem with that approach, it's not invisible. It's invisible if you have the wrong scanner. If you have the advanced scanners like fMR, functional MRI, MEG scanner, PET scanner, you can actually see amygdala overactivation. And you can actually, when the patient gets better, you can see deactivation of amygdala. So
Wow.
the point is you can actually see the effects of it, no different than a broken leg. So I'm a clinical guy,
Yeah.
so I look at everything physiologically. So that's kind of my thing.
I love that you take that approach, that clinical kind of physiological approach. I think that
Thank
it's
you.
a little bit different from what is happening right now, really kind of trending in our treatment of mental health conditions. But frankly, more and more people are struggling, right? There's more and more people who are experiencing suicidal thoughts, who are experiencing trauma and struggling to get through that. Anxiety and depression and all of these various conditions, and it seems like really no one's getting better. So this is a different approach, but in some ways it's not new, because you said that this that SGB has been around for decades, since the 20s, I think is what you said.
It's been 100 years. In fact, I'm writing a textbook, medical textbook for doctors like me.
Mm-hmm.
And it's called Stellate Ganglion Block,
Mm-hmm.
A Century of Progress.
Mm.
Right. So it's going
Wow.
to have a lot of specific things. But Stellate Ganglion Block has been the first time it was used for psychiatric condition was 1947 in the Cleveland Clinic for depression.
Mm-hmm.
But it was lost. People forgot about it.
Yeah, I
I
was going to
found it in the
ask.
textbook.
So it's not just PTSD or PTSI. It's not just trauma. It's many different conditions. So that's really interesting.
So let me tell you some of the condition that has been described as effective. Stellate has been effective for
Okay.
PTSD, near and dear to my heart, anxiety, depression. There was a paper out of Canada of schizophrenic. His voices went away after stellate.
Wow.
So I'll tell you the one we just described, which is kind of interesting to me at least. So this woman went through a lot. She's had a lot of childhood abuse and she had all type of issues. So she had 3 diagnoses:
Mm.
PTSD, psychosis, multiple personality disorder. She had
Wow.
13 personalities. The dominant one was, she called it the monster because she was so nasty. So she had 3 stellate ganglions in 3 years. No psychotic breakdowns in 3 years. She went from 13 to 3 personalities, and now the new personality is very pleasant and polite. And her PTSD got better. That
Wow.
weird?
That is so interesting. What a that I mean, that's cool, and it feels like the rates are much better than what we're experiencing, on the other side with medication treatment and therapy and things like that. Yeah.
No, very much so. The other thing is, again, the compliance is a huge thing, meaning taking medication is hard. But the other part, if there was a article written, I think it was New York Times, and they talked about deadly cocktail, that veterans are taking 7 different drugs, psychiatric conditions in the VA right now.
Wow.
You take one drug to do this, another one gives sedation, another one this.
Mm-hmm.
Atypical antipsychotic is one of the commonly used drugs, and those cause heart attacks and increase suicide rates. So those are dangerous drugs.
Yeah, yeah, absolutely. So let's talk about that a little bit more on veterans and just step back into PTSD and PTSI. So what exactly is PTSI?
So that was a term that was pioneered by Dr. Frank Egbert. He was a very,
Mm-hmm.
very famous psychiatrist. He came up with the term Stockholm syndrome. You probably
Okay.
heard that term.
Yeah.
So he was part of the committee that came up with the term PTSD in 1980. But through his exploration and what he was finding is that it was stigmatizing. So he felt if we can change the name, that it's an objective physical finding, that it's real, there would be less stigma. So then he got connected with Peter Chiarelli, 4-star general, who was in charge of suicide prevention for U.S. Army in 2012. They
Mhm.
both went to the APA, American Psychiatric Association, and said, please change the name to PTSI.
Wow.
And they said, no, thank you. So then I got connected with Dr. Agbert. He's 87 now, so he passed this hot potato to me now.
Mhm.
And I did a study in 2023 based on 3,000 people, and we asked them, what would happen if PTSD changed to PTSI?
Mhm.
So the answers were a couple. One, stigma will get better.
Right.
Two, there will be more hope. Three, they will be seen by clinicians. All good things. So I take all the information. I went to the APA in 2024, and I said, this is what we have. In order to change the name, the requirement, change the name, is to show that current current name is causing problems
Yeah. Potential
or
harm,
cause
therapy.
difficult harm,
Yeah.
right?
Mhm.
So I showed them my research, and they go, not enough data. So it's one thing that I would ask your listener to do is potentially go on my website, itsptsi.com, it's ptsi.com, and fill out a survey. I'm trying to do 10,000, 100,000, a million people to do it. I'm trying to get a large number of people to give me that information. And then I'm going to try again to change the name, because I really think PTSI term will save a bunch of lives. One
Yeah.
letter, right? I'm going to
Right.
be doing a TEDx talk specifically about that in San Miguel Allende in Mexico on January 15th.
Oh, that's fabulous. I'll look out for your TEDx. That's exciting.
Thank you.
Very cool. And yeah, I mean, language matters, and it's so important how we define things, how we
Yep.
explain things.
Yep.
And in some ways, you're almost helping to this approach gives us more control, right? It's saying that this is a biological disease, that we can actually do something to treat this, versus saying something like this is an invisible wound that is,
Right.
perhaps going to be with us for the rest of our lives without any sort of, getting better. So I like this approach, and it's very scientific. And from what you're saying, the results are there. So I think that that's really
Yeah.
exciting. So tell me more about the work that you've done around veterans. It is Veterans Awareness Month, Veterans and Military Family. At the beginning, you mentioned a little bit, kind of what are the treatments that you've done, and what have you seen in that veteran population?
Well, keep in mind, I have a jaundiced perspective because everybody I get to see have PTSD. So I'm interested so I've treated active duty as well as veterans of all branches. I specifically had an honor to take care of a lot of special forces guys, SOF.
Mhm.
And they're a special group in the sense that I did a SOF training with them. One weekend, right? I mean, an old guy running around blowing stuff up. Anyway, so what I found is that through their training, they do breaching, which is blowing holes in walls and taking down doors, all of that. That leads to BTBI, which is blast traumatic brain injury. They also have TBI, obviously, they're being thrown, whatever happens. So what we were able to successfully treat PTSD symptoms in them and their spouses, because I believe, I mean, it's been demonstrated that people can get secondary PTSD. So the guys go to war, they come back, they give it to the wives,
Right.
typically,
Right.
and children. So we've treated that.
Mm-hmm.
So what it has, I think you're asking what kind of symptoms have you helped? I think
Mm-hmm.
let's start with that.
Yeah.
It seems to work very well on nightmares, impulsivity. Somebody touched you in the shoulder, you don't want to whack inside the head, right?
Right.
Feeling of doom. Also, I wrote a chapter on in a textbook about that 85% of men have sexual dysfunctions secondary to PTSD. So if you can treat PTSD, the equipment works better, which has been a really lovely thing for a lot of the people we've treated. Not
Sure.
just the man, but the whole family structure.
Right.
So those are the kind of results we've seen. As far as people who had BTBI, blast traumatic brain injury, and PTSD,
Mm-hmm.
so I came up with something called SOF method. special operated force method, adds ketamine and stellate together. There's a synergy between the two of them, and we've used it successfully. It's actually being studied now in Northwestern and Fort Bragg.
Wow.
So they
Wow.
followed some of the research I came up with, which is it's really great to see because it really helps people a lot.
Yeah, and our veteran population really, really needs it. Suicide numbers are much higher, and at the top of the show, you mentioned your own personal experience around, being a family member. So
Yeah.
it's something that we really need, and it's so interesting because it's been around for 100 years. The results seem to be good. There's research to back it up. So why do you think that it's not as mainstream? Why are people still kind of fighting this? Or it's still a novel concept to say that, oh, PTSD is a biological disease versus a mental health condition.
Well, if you think about Planck was a great physicist. I'm going to give you an answer.
Mm-hmm.
And he got Nobel Prize in physics for Planck's constant, I think 1922, something like that.
Yeah.
He said, science moves ahead at funerals. The current people who are in charge have a particular thing they're interested in, and you need new blood in there. That's one. Two, I had a colonel come in from Joint Chief of Staff. He looked around and he said, "You have a problem with your project." I said, "What, you don't like results?" He said, No, my guy's been treated. They've done great. You're asking you're asking people who are currently in charge to be in charge of a second best thing. So whoever just follow the money and prestige, do you think they're going to let it go of that easily? Probably not so much.
Yeah. So that's tough. It's an uphill battle. But that leads to my next question, which is, what's the future? Is this where your book comes into play? Is it about teaching that next generation? Is it about educating the community? What are the next steps? Yeah.
Well, there are a number of steps. Step one is science, right?
Yeah.
If it's real, it should be able to figure it out, right? But the right scientific thing that should have been done a long time ago was FMR, functional MRI test, before and after stellate. It's not that complicated because there is still a lot of debate. Is it real? Is it placebo? Is that lies? Whatever. So it's interesting that I applied that criteria to what I'm talking about, while the stuff they're talking about, the drugs and all this, nobody uses that, which is interesting. So let's let that go. No problem. So in 2017, that was my suggestion to the VA. There should be a study done like that. Yeah. Of course, no, they wouldn't do it. No, I don't think so. Yeah. Why? Just because. I went to the number of forts to specialty PTSD. I don't think so. We have other place we want to spend our money. So then I ran into an amazing couple, Linda and Glenn Greenberg. They have a huge foundation, and they gave us money to be able to do a real study, which we gave to the NYU organization. So they've been doing the study for 3 years now. Hopefully, first or second quarter of next year, the results will be in. And I think that's going to be a significant change. Yeah. Because there's nothing like a real big organization like NYU, with real scanners, with real psychiatrists, with real everything, actually demonstrate the differences, right? That's what it's going to take. And I think we're close. I think we're maybe 6 months away from publication and all of that.
That's so exciting. That's so cool.
I agree.
So
I've been trying for a while.
I bet. And you've probably been writing your book for a while too. So tell me more about your book. You said that that's also coming out next year, right?
Yes, the book's coming out February 17th. So the name of the book is cool. Let me tell you the story. It's called The Gut Shot. And the reason that name came about, I took care of a Marine guy, and one of his buddies had stellate before, and he said you should go get the gut shot because it changes lives. So I love the name. That's why we use it to name the book. But the gut shot basically talks about there's one chapter about my life, why I'm interested in it at all, because it's weird for a pain doctor to actually have an opinion about PTSD, let alone come up with a new section of it. And then we talk about secondary PTSD, but ultimately it's a book of hope, meaning it's possible to get better. There are going to be things that you can do to get better. Nobody killed themselves, they have hope.
Yeah.
So that's why I'm big into hope promotion and everything else like that.
Yeah, absolutely. That's amazing. It sounds like a really good story. Are
It's
there,
well written, not by me. I had somebody else write it, but
okay.
Lauren wrote it. But I think she's a beautiful writer, and she's done an amazing job.
Oh, that's beautiful. I love that. Okay, so I'll look for that to come out early next year.
Thank
And
you.
is it for doctors or is it for,
No.
the public? Yeah, it's for anyone
the
who's
public.
interested. Yeah.
I've published about 22 articles for doctors. I think I've done a pretty good job. And there's going to be another textbook coming out. No, I call this type of writing sciencey.
Yeah.
Sciencey in the sense that there's enough science to keep it interesting, but there are anecdotes, and she keeps it light, and she describes things beautifully. It's not long. It's about 200 pages. It's not like a tome that you cannot get through. Because the idea is to get through it and actually you do something with that, right?
Exactly.
So I'm a clinician. I do interventions. I don't just talk about things.
Yeah, exactly. Are there other clinicians who are doing what you're doing in this space, who are offering this service around the country?
There's a couple of, yes, absolutely.
Okay.
There's a number of people who followed our work. So I'm a CMO, Chief Medical Officer for Stellate Mental Health. So we have 24 sites in the United States. We have 1 in Israel and 3 in Australia.
Okay, great.
There are other doctors who do Stellate as well.
Yeah.
Absolutely.
Yeah.
Some better than others. I mean, I know some very good clinicians and some.
Sure. Probably.
So
Yeah.
you got to be careful. You want to make sure people are trained and they use the right guidance systems and all of that.
Yeah. Do your research. Definitely.
Yes.
Yeah, definitely. Well, so I want to ask you another question here that I always like to ask my professionals, and I think I have an idea of, how you're going to respond to it, but
maybe.
But we'll see. Yeah. So, and the question is, do you think that a mental health challenge or a diagnosis is something that, somebody can overcome, or is it something that, really needs that they have to deal with for the rest of their life? And it can be trauma, but it can also be maybe something, like having psychosis or dealing with depression. But I kind of think I know where you're going with it, but I want to get your answer.
Well, I'll give you 3 answers to that. How's that?
Okay. Yeah.
So PTSD and mental disorder is not a lifestyle, number 1. Don't give up. Keep fighting until you win.
Yeah.
I think that's 1. 2, when I've done pain for years, and I always told people, think of your brain as a car. If you close your eyes, you're not going to stay in the road. If you keep your eyes open, you're more likely to get where you want to go. Point is, if you want to get out, keep looking, try to figure it out. So I personally had suicidal thoughts when I was 6. I don't have any of that now. I have normal mild stress, but I don't have extreme stress, depression, all that. All got treated and all went away.
Sure.
So
Treated with Stellate.
Stellate helped. My, Dick Schwartz and his organization's done a beautiful job helping me. So all of that meditation, losing weight, all of that helped me a lot.
Okay.
Being married to an amazing woman, all of that stabilizes people.
Yeah.
Right? All of that. So the point, and then the other part is I'm looking at some new ways of diagnosing PTSD and psychosis using autoimmune assays. And maybe there is a way to do immune modulation to take away mental conditions. So the point is that it's getting more biologic by the moment. So the answer, absolutely, it's not a lifestyle. There's all type of things that can be done. It should be done to get better.
That is so interesting, that you're saying it's getting more biological, and we're taking more of that scientific approach by the moment, because I think in some ways in the last 20 years, it almost feels like we stalled out on SSRIs and really just that's our only approach is, talk therapy and, and antipsychotics and antidepressants. And it's just, there's got to be something better, and there's got to be a different, something out there. So I like, that there is. It seems like there's more than
I think you're right as far as stalling out, but I
Yeah.
think I don't think people are tolerating that anymore. That I mean
don't
that
think they are.
all of this thing of okay, fine, I'm going to be sick the rest of my life. People are getting tired of it,
Right.
and that's true across the board. It's not just psychiatric conditions. Regular medicine. There's a lot of people doing alternative medicine. They're doing complementary medicine,
Yeah. Mm-hmm.
holistic medicine. Oh, but the point is, I think people are becoming, since everybody's talking to each other, they're going, well, this didn't work for you. Well, it didn't work for you. A million people telling it. It's like, it's not going to work. I mean, maybe it's time to switch something. Let's do something different. Let's get rid of all the pills. I'm not suggesting that, but I'm saying some people take that approach. Just get a dog and go walking in desert. And that could work for this sector population. Let's do stellate. Let's do TMS. Let's do immune infusions. And people are like, oh my God, this worked for you? Oh, wow. Psilocybin is becoming a big deal, right?
Yeah.
Flash news. It's been used for depression and mood improvement for 3, 4, 5,000 years. Whoa, what? That's crazy talk right there, right? So the point is, people are starting to go, well, I'm not willing to be depressed the rest of my days. I don't want to be miserable. Yeah. Unfortunately, on top of everything else, we have social media that scared the hell out of people. That's a problem. Also, there's a lot of people who are addicted to various things, and that's a problem. And addiction is being looked at. We can talk about addiction forever. But the point is, I think people are getting to the point that they're looking for something that actually works. It's not all sales job. There's real biological things which are coming online, and there's going to be new sensors and all of that. Because right now, psychiatric assessments like, I think you got PTSD, have a feature of anxiety, depression, blah, 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 blah.
Sure.
Oh, what do you do with all the information? Okay,
and it depends on the professional you're in front of too. Like one day you have this, the next day you have that. Like it's right.
But also the therapeutics are also not specific.
Yeah.
Like, lithium is used for bipolar disorder, for example. Because lithium is a great drug, but it has a lot of downsides. But my point is, most other things, depression, anxiety, the same drugs are being used. And some of them, like benzodiazepines, are addictive.
Yeah.
I'm not a psychiatrist. So as I said, I don't write those kind of medications. Certain times you can use medications. Certain times people do well. That's marvelous. But people who don't, try something different. Ketamine infusion has been shown very well by Dr. Crystal from Yale that it works well for depression. Okay. Stellate, I think it works well. TMS takes a while, but it seems to work well. Psilocybin, not legal in this country. It's legal in some states. I think it's kind of grayish right now.
Sure.
But some people have great results there. The only drug I don't like is NDMA.
Okay.
I'm opposed to that drug. The rest of them, they certainly have a place.
Okay, that's so interesting. I really like that. Again, that approach where it's like, let's stop taking things off the table. Let's look at what's been on the table for thousands of years and apply some research to that and really see what works.
Yeah, exactly. For example, Ibogaine, amazing drug for addiction. Amazing. Stanford studying it right now for TBI and other things. However, if you're going to do it, don't do it in a cave, because it can stop your heart and give you arrhythmia. So it needs to be done by people who know what they're doing. They're going to give you magnesium to stabilize your heart. They're going to monitor you, and it should be safe. Yeah. The point is, you need to know, and that's what the stuff is in the book. That simple type of advice. It's like, this, okay, but be careful of this. This, okay, but be careful of this, right?
Right. Yeah, I mean, information is power and science is power. And I think that, people have not given science its due diligence in the last, few years and 10 years or so. So,
yeah, that's another story altogether.
That
It
is
is
totally different
everybody's an
topic.
expert, right? Everybody's an expert at everything.
Right, which again goes back to social media. It can be harmful on an information perspective, but then also, just on a mental health perspective. So there's pros and cons to the world
Well,
that we live in.
I'll give you my suggestion.
Yeah.
This is why during COVID, a lot of people asked me for advice.
Yeah.
So here's my advice. It's really simple. Exercise. Expose yourself to nature. Turn off all the ding-a-ling-a-ding, all those things. Don't get continuous alerts. Do social media 1 hour per day only. Do it in the morning, don't do it at night.
Okay.
Don't be exposed to screen time at night. If you don't sleep, mental health will deteriorate.
Yeah.
And don't drink a lot of like energy drinks and things like that. That's a problem. It can cause its own type of anxiety, the problem. And then people go up, oh, I can't sleep. I have to take a downer, up, down, up, down.
Right.
It's all bad for the brain.
Right.
Really simple advice. People know to do it, but they're like so cautious, like, oh my God, I missed this update. Oh. Unless if you're running the army and you need to be informed, that's a different story. If you are somewhere and you don't have responsibility of that level, 1 hour a day is plenty to find out all the bad news. It's not going to change. If you know moment by moment, ain't changing nothing. It's going to change nothing. Supreme Court decision will change nothing in your life. It's just not going to happen that quickly. You can find out tomorrow and be disgusted or be happy tomorrow. But you don't have to be paying attention by the ding-a-ling-a-ming-a-ting-a-ding, all that. Nuh-uh. And the thing that's really cool about, like, at least iPhone can do this. I have 5 numbers that if I put it to private time, people can get to me. Short of that, no. It says my private time. I'm going to meditate. I'm going to take care of me, right? Got to take care of you.
Right. That's the best advice. I love that. I fully agree. I think that we don't need to be digesting news 23 hours a day.
No,
it's not healthy for our mental health, right? So it's important, when you're struggling, to have these other solutions, but it's also important, like you're saying, to apply these good life techniques, to get enough sleep, to go into nature, to put yourself first in many ways. And we're constantly putting the world, I think, on a pedestal versus ourselves.
Well, the other thing, if I may, PTSD increased the rate of heart attacks by a factor of 2.
Wow.
It causes sexual dysfunction in men in up to 85% of the time, right? Wow. So just PTSD, I'm not talking about other issues. The point is, mental health, there is a price. People age faster who have mental health dysfunction. It has a price. So the point is, it's possible to do, and it's well worth it. Also, do monitoring. Like, this is Oura Ring. Monitor your sleep, monitor your heart rate, monitor your HRV, know where you're at. All of that is not that difficult to do.
Yeah, absolutely. Yeah, we have those technologies at our fingertips, and
literally.
Literally, exactly. Well, thank you so much for your time. This was such a great, informative episode. You mentioned a website earlier, but I want to, ask you, how can people get a hold of you? I believe it's PTSI.com. What would you like people to do there? And if people want to reach out and learn more about, what you're doing in your services, or maybe have you come out and speak and teach, how can they get a hold of you?
Perfect. So I'll give you a few websites if that's okay.
Yeah.
Well, the first thing is, I think the name needs to be changed to PTSI. If people can go to itsptsi.com, there's a survey. It's an IRB-approved survey. I want to get 10,000, 100,000, maybe 1 million people to fill it out. And then I'm going to go back to the APA, try and change the name. 1. 2, EugeneLipov.com. If people want to get a hold of me about science and all of that stuff, also all the papers that I've written and other people which are relevant are on that. So you want to do science, not science-y reading, that's the way to go. If you want to look at the book and pre-order it, it's called thegodshotbook.com. And the last thing, if people want to get treatment, if people want to go to stellamentalhealth.com, they can set up an appointment either with me or my colleagues closer to you.
Okay, fabulous. Yeah, because you said that you're all over. So that's so great. So thank you so much for your time again. This was a really, really powerful episode, and I appreciate it. And this was great for November as well. So with that,
Thank you.
yeah, I definitely will want to have you back anytime. But we are live every first and third Wednesday of the month. So for anyone who's tuning in, join us next time, and then join us on katierosewaechter.com to see this episode afterwards, or wherever you listen to podcasts. We will be there. And with that, we'll see you next time. Have a good one, everyone.